Welcome back to another episode of the Association Spotlight Series. I'm Lake Morehouse, and today we are joined by our new guest, Dr. Ashleigh Parker. All right, Ashleigh, so if you just want to tell us who you're with, you guys are a member of our association here and joining us from the northern part of the state, so we're really excited to have you. But if you just want to tell us a little bit about what you do and your role.
Okay, yeah, so thanks again for having me.
Yeah.
Again, my name is Dr. Ashleigh Parker. I have a doctorate in behavioral health, specifically on the management side, but I do have some clinical background as well. I have been in the clinical field for several years now under the behavioral health spotlight, as well as nursing and some other areas
Sure.
within the clinical environment. But I am the president and CEO of Crittenton Services Incorporated here in West Virginia.
That's great. Yeah, and how long have you been in your role now?
I've been in my role since January.
I was going to say, you're one of our newer CEOs.
I am one of the newest ones.
Yeah,
yes.
we're excited to have you, and it's been great to really kind of learn more about Crittenton, and obviously they have been a member of us, but you guys seem to be doing some really exciting stuff now. And if we could just talk a little bit about what kind of services you all provide and what you all do up in what areas you cover in the state.
Sure. So we do offer residential services to pregnant and parenting adolescent teen girls. One of the really exciting things that we're moving towards this year and into the next couple of years is we are actually building a ASD, so an autism spectrum disorder program within our campus. So we're really excited about that. Right now our staff are going through all of the trainings, and that should definitely be up and running by the end of the year. So we're extremely excited about that. We also offer outpatient therapy services. We were only hitting about 5 areas within the state, but now with telehealth being the new thing, we are now expanding to the entire state of West Virginia to offer at least telehealth services.
Great.
We did just recently hire a new therapist here in Kanawha County, so we're really
Moving
excited
in.
about moving in here to Charleston. And then we also offer educational programs.
Yeah.
So we do offer expanded school mental health services. We also offer before and after care. We have daycares within our facilities. So, and we're still looking to expand on our programmatical things as well. So we're really excited about the changes that we're making, and of course the expansions that the organization is going through right now.
Absolutely, and it sounds like you guys have a nice spectrum of great services that you all offer, and
yes.
Especially now I think in West Virginia it's very evident, and folks have been top of the fold for sure about kind of the foster care and the children crisis that's kind of happening in our state.
Correct.
What have you guys kind of seen the trends of up north in your way of things that you're seeing on the everyday of what our children are kind of experiencing in the state, and so maybe some things we can do to try to keep combating it. I know it takes everyone. It's a tough lift, but it's continuous.
So I think that one of the biggest things that we notice, especially within our girls at our residential facility, is the substance abuse disorder.
Yep.
And as we know, West Virginia is the #1 state for crisis in West Virginia, and especially how it affects our youth within the state. I know Jeremiah Samuels just recently did a presentation for the Department of Health and Human Services, and he, did indicate that in his presentation. And we do see a lot of how that is affecting our girls, from girls that are without any parents because of loss of substance abuse, girls who are dealing with substance abuse themselves. Also, now we don't necessarily have the extremely aggressive, on our campus, but we do offer substance abuse training classes. And then for those girls who are pregnant, we offer some, parenting classes. So just, an abundance of children that haven't necessarily been afforded a great life, a great childhood. And, we're extremely grateful that they're in our care. And I think that we take such a great care of them. But I would say that substance abuse disorder is definitely one of the things that's really, really hitting us the most. We even see it in our outpatient therapies as well, and how those therapists, deal with those on an outpatient basis. Those instances on an outpatient basis as well.
Right. It seems to just be a total, what that can do to a family, and the trickle down effect to the youth, to the parents, and grandparents are raising kids. Probably, I think there's some parts of the state where it's more than 50% of the population. I think where grandparents are raising their grandkids.
Yes, exactly.
Yeah.
And, I would say the one positive thing about it is that there is a sense of a village, I would say. I am extremely excited that the state has recognized this and, has stepped in, but I think that we can do better.
Absolutely.
As we know, there are children that are in the foster care systems that are, housed in colleges, housed in, 1-bedroom hotels, with a DHHR worker. And, we really need to start looking at how do we eliminate those issues, and how we really pay attention to the crisis that it's causing. And
that's well said. Absolutely.
It's tough to think about. It really is.
It really is.
It really is tough to think that that's where the children of our future are landed. I'm really concerned about the future of West Virginia. And, hopefully if we're just one organization that can try to make a difference, I'm right there and ready to roll that ball.
And it sounds like you guys are doing absolutely great work, and those services are so needed, clearly. This would be a good point for us to take a quick little break. I'm just gonna we can reconvene after this, but just 1 sec. We'll be back. All right, and we're back here with Dr. Ashleigh Parker again from Crittenton Services. Ashleigh, so what was, do you remember what your first job or career choice was in behavioral health, or what kind of led you to behavioral health?
Yeah, of course. So it's kind of an interesting story if you have the time.
Sure, of course.
So throughout my entire life, I wanted to be a pediatrician.
Okay.
I wanted to be an MD. I wanted to be a pediatrician. I even knew what school I wanted to go to.
Oh, wow.
And I even got into the pre-med program. I went to Kent State University for undergrad, and I was even in their pre-med learning community. Okay. So instead of me starting to take my general classes, I was actually taking my pre-med classes first.
Gotcha.
And even though I loved it, I would say that I probably wasn't applying myself as much as I should have. Mm-hmm. And I ended up switching my degree. It was my sophomore year, second semester of my sophomore year. I ended up switching my degree to healthcare administration and information systems. Okay. So that's actually what I have my bachelor's degree in.
Gotcha.
Also, I was a 5-year, college student. And in my last year, I had my daughter.
Okay.
And realizing the stress and the mental toll and the mental anguish that it has on such a young person, mm-hmm. I knew that I needed to do and be something a little bit greater than what I was kind of challenged with at the moment. Mm-hmm. So I ended up working for Cleveland Clinic Hospital for a little while. I was just a health unit coordinator there, and kind of that's when I just fell back in love with being in the clinical environment and sure. helping out and just doing anything that I could to be in that moment. And then I realized I wanted to go to nursing school. So okay. I moved back from Ohio, back to Pennsylvania, back in with my parents. Mm-hmm. And yep. I went through nursing school, and unfortunately in my last 8 months of nursing school, I ended up having a traumatic back injury.
Oh.
Since then, I have now had 4 back surgeries,
Oh my gosh.
which has caused some, I would say, some delays in, what I've wanted to do, because unfortunately my last surgery left me partially paralyzed on the right side. But at least I'm up and I'm walking now. I'm no longer in a wheelchair, so I'm extremely thankful and grateful for that.
Congratulations.
Thank you. Yes. Thank you very much. But it just really, while I was in nursing school, I was working on the geriatric psych unit. And geriatric psych is, completely different than adolescent psych or childhood psych or even adult psych, right? Because majority of the individuals that we're dealing with on a geriatric level have somewhat of a dementia component to them, right? So usually they come to us because they've become aggressive within their institution, and then they have to come to us to try to get, regulated with their medications, and then we just basically send them back off to their to their nursing facility or assisted living facility, wherever they're located. So then after that, I kind of moved into the adolescent realm, and I was working with sexually maladaptive boys, all with an extreme aggression, and all of them had an autism disorder. They in order to be in our facility, they had to have an autistic diagnosis.
Gotcha.
And I absolutely love them. It was a unit full of 32 boys. Actually, we had 3 different units. We had our high risk unit, our younger kids unit, and then our older kids unit. So I actually managed the high risk unit.
Gotcha.
And for what you would think, to be high risk, it really wasn't. I think that it all is about paying attention to the child, making sure to talk to them as how you would like to be talked to, of course. And how can we get through this versus, we're just going to get into a restraint until you calm down, because unfortunately those are the types of kids that we had. And sometimes, it is, like I said, the unfortunate thing that you cannot stay away from. You cannot stay away from extreme aggression without, some form of, physical restraint, which we did do a lot. And here I am, this 5'4" little girl, trying to, not woman, but trying to take down, 6'3" kids by myself when they're, a danger to themselves and to others. And it is challenging, but I think that within that challenge, that's that's where my passion comes from, and now working with a brand new population. I mean, we are the only institution in the state of West Virginia that actually provides residential care for pregnant and parenting girls. So, I mean, I love going over there and talking to the girls and talking to them about being a young mother myself.
Absolutely, you can relate.
Definitely not as young as them because we're seeing girls between the ages of 12 to 18, but, definitely, and sometimes younger than that if we do get, someone for placement, because we are the only agency that does provide those types of services. But, going in there and seeing the babies and being able to talk to the staff about, how to handle certain situations. It's extremely important to me. But that, to go back to your initial question, that's honestly where my passion came from.
That's where it started.
Kind of how it's developed from there. And I'm absolutely loving what I do. I love my team. I think we do an absolutely amazing job. And in just a few short 8 months here, I mean, we've made some drastic and amazing steps to doing better for the children, the adolescents, the youth, and just all over, people with mental health disorders in the state.
Right. Yeah, absolutely. And that was going to be my next question. I think you already answered. Was that what you love most about your job? But I think you really expanded on that.
No,
and it comes from a great place,
right?
And it really comes full circle from a lot of the things you mentioned with your early career and the things that you all are doing now. It's incredible. I know that we're so proud to have you guys as members of our association. You all are doing great stuff, and it's very evident across the state.
Thank you.
It's you all are very critical, and it's been great to watch you guys grow. Again, even just the exciting. Just past 8 months,
Right.
like you said, has been great.
It has been.
Yeah.
And if I could just kind of maybe push a little plug here.
Please do. This is what it's for. This is what we're here for.
So, one of the things that we have been finding challenges with is that people do know the Crittenton name. However, they don't know the Crittenton divisions.
Okay.
So
right.
I definitely do want to put that out there that, we do have our residential facility, which is located in Wheeling, Ohio. And then we have our Wellspring offices. So right now we have 5 physical locations.
Okay.
We are now adding a 6th one here in Charleston. It won't actually be a physical location right now, but we can still provide physical services.
We'll call it a presence.
So yes exactly. So definitely want to push for Wellspring because as we know, providers themselves, especially other residential providers, are actually having problems finding community-based services. So this is our community-based service division, and we can see anybody from the age of 3 all the way up until 99.
Right, exactly.
So, definitely want to push for Wellspring, and then our Willow Tree services. Right now, we have the expanded school mental health services in 6 schools. So we're in Mon County, we are in Hancock County, and also in Ohio County.
Okay.
So we are looking to potentially expand the expanded school mental health services throughout the state also. Looking for those grants and just wanted to kind of push that out there.
And also, too, with this, when this comes out as well, we'll post links to all your service, your websites, and for people who are trying to find some kind of delineate a little bit and see where everything is. But we'll have all that information posted for you guys as well. Yeah, well, that's great. Actually, I don't have any more questions. I don't think it's been a great conversation. Thanks so much for coming down from.
We love
guests.
Talking to you guys.
I know it's great. I wish we were closer. We do. West Virginia is a little bit smaller, so we can see people from the farther parts of the state. We are lucky in that regard, but it's still a little bit of a haul. So.
Right. No, that's perfectly fine. Like I said, I love coming down here and talking to you guys.
We're so excited. Well, thanks so much again for your time, and we loved you coming down and talking and learning more about what Crittenton's up to, and your journey is super inspiring and so interesting. And we'll keep on the lookout here for the future of Crittenton.
All right, perfect. You will see us. You'll see us on the map.
There we go. Thank you.
Thanks.